Good evening. I'm Patricia Van Skyke, Director of the Lloyd Library and Museum in Cincinnati, Ohio, and I'd like to welcome you to Eclectic Physicians, Diversity, Inclusion, and Equality. The Lloyd Library was founded in the late 1800s by three brothers, the Lloyd brothers, all trained pharmacists who conducted research and collected books from around the world to aid their understanding and development of nature-based drugs. The Lloyd brothers were adherents to the Eclectic School of Medicine, a topic we'll hear about more tonight. The oldest brother, John Uri Lloyd, taught at Cincinnati's Eclectic Medical Institute. He established the original Lloyd Library near the EMI and across the street from where we currently stand to support the research of students and faculty there. The collection became the basis for our current library, now numbering more than 150,000 books, including rare, historic, and also contemporary works. And the books are still used by medical professionals and historians today. Among the many differences from conventional medicine, the Eclectics were known for their inclusive practices. Our presenter, Dr. Amy Welling-Gregg, brings a depth of knowledge to this topic. Amy was a 2019 fellow at the Lloyd Library, where she conducted research on 19th century American medicine, the implications of professionalism, capitalism, and implicit bias. As a medical, humanities, and social justice scholar, she focuses on the intersection of race, gender, class, sexuality, and ability in American medicine, pharmacy, public health, and bioethics, continuing the work that she did here at the Lloyd. She currently teaches at The Ohio State University in the Department of History, Comparative Studies, and International Studies, as well as the College of Pharmacy, where in June she will begin full-time as a senior associate lecturer there. It's now my pleasure to introduce Dr. Amy Welling-Gregg.
Thanks, Patricia.
Hi, Amy.
Hi. Thank you for welcoming back to continue to talk about my favorite subject, the Allopaths and the sectarians and the Lloyd.
Thank you.
Thank you. And for those of you who have questions, I will be happy to answer, as Erin said, after the lecture, if you don't mind. So I'm going to go ahead and get started. And the first thing I'm going to do is share my screen with you so that you can follow the PowerPoint. There's a lot of narrative that I talk about that's not on the PowerPoint, obviously. So I want to start, though, with this idea of the eclectics and what was at stake for them. There was, the 1800s was a contentious place for medicine in a time when it was developing as a profession. All right, so let me go ahead and share the screen with you. And right, so when I was at the Lloyd, I went down there with the intention to compare and contrast Curtis Gates Lloyd, who was fascinated by mushrooms, by fungus, with the topic of my master's thesis. So I have a bachelor's and a master's degree in American history, and then a master's degree and a PhD in comparative studies. And my work for the master's in history was about Francis Pierre Porcher. And I was interested in him because he is a trained allopath. However, he was from this section in Charleston known as the Botanic Quartet, where botanic medicine was very much a part of the medical therapeutics well into approaching the Civil War. And then during the Civil War, he is asked by Confederate Surgeon General Samuel Preston Moore to write a botanic book about materia medica, plant medicines, that the Confederate Army as well as Confederate citizens could use due to the lack of medications from the Union blockade. Porcher was a big believer in the therapeutic effectiveness of mushrooms, which in modernity, we're coming back to the power of mushrooms as having medical efficacy in treating various disorders. So what I want to talk to you though about, so I'll give you some background because there's, to understand the contentious space and place that was 19th century American medicine, you're going to need some understanding between these Allopathics and the Eclectics. And we will come back to this point of kindly medicine. But before I move forward, I just want to point out to you that I want you to keep in mind as I'm talking about these differences between the Allopathics and the Eclectics and what was at stake. What's absolutely fascinating about the Eclectics, I mean, there's many things, but what took me off course, as those of you who are researching geeks like me will recognize, you get into one of those famous archival file boxes and you just lose your mind in the joy of the search. And so I was interested in Curtis Gates Lloyd, but I can't remember if it was the first day or the second day, but it was the first week of my fellowship. And I came across work by John King, who was an MD at the EMI, the Eclectic Medical Institute. And he wrote the American Dispensatory in 1854. And right away in the preface, he's defending the position of being an eclectic. So I was very fascinated by his approach because one of the things he talks about, so he's talking about a dispensatory as a description of therapeutics and how do we use therapeutics in the treatment of disease. But in this preface and in his narrative and it throughout the book, he's talking about the value of eclectics as practitioners, which was being challenged. And he's also talking about the importance of what we in modernity would call humanism, about treating patients with dignity, with compassion. And I came across this phrase, kindly medicine, in various EMI journals, in lectures by various EMI physicians, in their ethics and speaking to their medical students about this idea of practicing kindly medicine. So I was very intrigued by that. One of the tenets of comparative studies that I deeply value and appreciate is the idea that whatever scholarship we do as comparative studies scholars, we're trying to look at something from whatever angle it is, because we don't really compare things, we intersect disciplines. And then see if there's some way we can find a solution for an issue that is present in modern society. And the lack of equality in America's medical system is very much in the forefront of my mind, both from a professional and personal perspective. And then obviously, I think many of us have been alerted to that with COVID, if not beforehand. So for a physician from 1854 to be talking about this idea of equality and compassion. Now, you have to stop and think about the language of the 19th century. It's far more flowery, it's far more romantic. What I have discerned in the writings around this phrase, kindly medicine, is that what they're actually talking about is inclusion, diversity, and equality. All right, so inclusion, diversity, and equality as practitioners. So allowing women, people of color, and people of differing faiths. So Catholics, Muslims, Jewish, individuals were allowed and accepted into eclectic medical universities, which was not necessarily the case in most allopathic schools. It's why we have medical schools that are formed for people of Catholic faith, people of Jewish faith. It's why medical schools are formed for women. They were not included in this process of professionalization. So that's part of this idea of inclusion, equality, and diversity. They believed that by having this diverse student body, and then upon graduation, this diverse set of practitioners, that in that diversity, medicine would be improved, the human condition, interaction with illness, whether it's acute or chronic, would be improved, that solutions could be found. So that's that side of it as far as the practitioners. The other part of this kindly medicine was the idea that regardless of, and so mostly I'm talking about the 19th century, so there, what the social categories of constructs that are dealt with are race, gender, and class. Sexuality and ability come into the early 20th century, late 1800s, when we're talking about eugenics. So for this conversation, we're looking at race, gender, and class. What the eclectics were very concerned about was making sure that their practitioners were treating their patients with dignity and compassion and equality, regardless of their social construct, regardless of their race, regardless of their gender, regardless of their class. They believed in treating the whole person with dignity. All right, so I want you to keep that in mind as I go through this background, and we'll come back to that. You'll see this slide again later in the talk. All right, so there's a quote up here that I'm going to give you some background to. How did I stumble into this conversation? Well, here it is right here. This slide that you see here with this quote by Benjamin Smith Barton. As I said, my master's thesis was on Francis Pierre Porcher, which I actually began my work as a graduate student doing my research at the Lloyd many years ago, and I stumbled into Porcher. And as I was writing the master's thesis, I came across Smith Barton's Materia Medica. And I was absolutely stunned at the language that was being used. I was so bowled over that I put it in a special manila envelope and wrote, "This is the start of your dissertation," which was, 2 years down the road. So actually more like 4 to get through the master's and then the coursework. But that's how powerful this was to me. So what is he talking about here? Well, what's going on at this time period for Smith Barton, what he's doing is he creates this collections for an essay towards the Materia Medica of the United States. What's a Materia Medica? It is a book that contains medical material. Materia Medica is Latin for medical material. So it's plant medicine, it's pharmacognosy, all right? And pharmacognosy is the modern word for plant medicine. And what he's doing is, prior to the United States becoming the United States, but we were a colony of mostly Great Britain, we were using the Materia Medicas from Great Britain. One of the things that happens in this period after the revolution is this early Republican excitement for all things fantastic in America. So for those of you who have read Notes on the State of Virginia, so Jefferson's argument and about how great the United States is in arguing with the count. So that's what's going on here. And so what Smith Barton is doing is he's going around the country and he is collecting different medicinal plants how they're used and who uses them for different treatments, how it's made, what kind of decoction. Is it a decoction? Is it a concoction? Is it a poultice? So on. And one of the things that's happening here as well is in the early 1800s is also the idea of heroic medicine starts to be questioned. And what is heroic medicine? We'll come back to that, so just hold on to that idea for a minute. One of the things that Barton is doing is he is participating in this idea that the chemical-based drug calomel, which was the drug of choice during the American Revolution, it was supported by Dr. Benjamin Rush, and it was given in these doses so large that it was known as heroic medicine. So the idea was if a little bit was good, then a whole lot was better. Well, let me put it to you this way. Thomas Jefferson sent Meriwether Lewis to the College of Physicians in Philadelphia, where Rush was the professor of the college, and had Rush train Meriwether Lewis so that he could take care of the crew for the Trail of Discovery. And in his notes, he talks about that one of the individuals became ill, and he administered one of Dr. Rush's thunderbolts. We had to make camp for 10 days. This is one thunderbolt. For any of you who have dogs, they are the size. They are described as being the size of what we now use as heart guard pills for our dogs. So you can imagine if you have to make camp for 7 to 10 days because of one pill, the effect on the bowel region of moving material out of the body, right? And so one of the things that's going on is the public is starting to push back against these ideas of these medications because, as you obviously can discern, they're quite dangerous. And also, this is the age before we get into heavy chemicalization. So materia medica was the traditional form of therapeutics, pharmaceutical therapeutics. They weren't called pharmaceuticals then, but in your modern vernacular, that's how you would phrase those. So they're using plant medicines as therapeutics. So what Barton does is he goes around the country and he collects these. And this quote is talking about Native Americans. And he says, the Indians of North America are in possession of a number of active, important remedies. It will not be denied, however, that they do not always apply their remedies with judgment and discernment. But what treasure of medicine may not be expected from a people who, although destitute of the lights of science, have discovered the properties of some of the most inestimable medicines with which we are acquainted. But a knowledge of the obvious habit of deportment of their plants and of the general properties of these plants is indeed a very prominent feature in the description of many savage nations. So I want to break that down for you just briefly. What he's talking about there is going to Native Americans, different tribes, and learning their materia medica therapeutics. He's going to learn their botanic remedies. He acknowledges that they have this information as the natural inhabitants of the land, as being people who possess connection with nature. But notice this line here, who, although destitute of the lights of science, what he is doing there is undermining their intellectual ability to practice therapeutics in more than an observational way. All right. If you go on to read more of his insertions in his materia medica and his writings about Native Americans, you understand that what he is denying them, not that they are certainly fully human according to him, but that their intellect is not capable of understanding the science. You can see this next slide, but it's only with their general properties that they are acquainted. For the discovery of these, the uncultivated reason of man, even the wild instinct of the animal, are often sufficient. It is the province of science. It is the duty of those who attach themselves with a well-guided ardor to the amicable pursuits of medical and natural science. I was blown away by that section in his Materia Medica, because he has just reduced Native Americans to functioning with their medicine purely from an instinct perspective, from the instincts of animals. It's obviously blatantly racist and oppressive. So I held on to that. And as I was doing more research, what I learned was that this was a sentiment that was carried into perspective of the medical approaches that were brought from Africa by enslaved Africans and then passed down to enslaved African Americans. It was the same attitude towards women with their recipe books. So you have to stop and think about the sphere of gender as it relates to women. Caring for the sick and illness was very much in the sphere of femininity. It's in that sphere of domesticity. And so you also, of course, you're having the midwives as part of this practice. So what happens when you get into the 1800s, where women and knowledge of people of color, and also Amish physicians, Quaker physicians, and the information that the lone mountain man would go out and find, particularly Appalachian docs, as they were called. What happens to the respect and the authority that's given to them as being participants in the healing practice of medicine? So there's this process that's going on in the 1800s, that medicine is starting to be recognized as an institution that needs to be professionalized. The background of the medical system in the United States was based on the laissez-faire policy of Great Britain, meaning that the economy would determine if someone was a good practitioner or not. All right, so you didn't have to go to university to become a physician. One could be an apprentice, or by the age of Jacksonian America, you could put out a placard and say you were an apothecary, which is the antiquated word for pharmacist, or an apothecary doc, which is an apothecary making the remedies and then also practicing medicine, that you could put this placard out. And the economy, the laissez-faire capitalistic approach, would determine if that person was a successful practitioner or not. The question becomes is how many people does the individual injure or kill in the process, right? And so this need to professionalize medicine is very much an issue, right? It needs to happen. There needs to be a standardization of the educational system. There needs to be a standardization of association, so and licensure, as a way to regulate who is a practitioner of medicine, who has the knowledge, and who's not going to kill their patients with trial and error because they didn't actually have any education. So this need to professionalize was there. But the other reason that this professionalization process is happening is because of this heroic medicine approach, all right? So this heroic medicine approach of the physician engaging with the body at an intense level to regain balance in the body. So if someone has a fever, So for those of you who are unfamiliar with this idea of the humoral, the humoral theory of medicine, this is introduced by Hippocrates back in 400 BCE, and this is holding on until we get into the Paris Clinic from 1790 to 1850, when in this Paris Clinic, it's called the Paris Clinic because it was there was a system of hospitals and universities engaging with the ideas of new science and experimental science, education, including dissection and live observation of procedures and surgeries. All right. So they start to, the physicians coming out of the Paris Clinic are challenging this heroic idea, this idea of humoral medicine that heroicism builds on. So, for instance, some of you may recognize the gentleman's name that I'm going to mention, George Washington. So what happens to George? Well, he goes out for a ride on his plantation and he comes back and he has a sore throat. He most likely had an infection of the epiglottis, is what we're thinking. Other people think there might be one other thing, but so anyway, he's sick, right? He's got a sore throat. He has a fever. And the idea was that his blood humoral was out of balance. So the treatment was bloodletting. Now, in the middle of the 1600s, William Harvey, an English physician, deciphers circulation of the cardiovascular system, experimenting on a live dog. So they understand circulation to a point, but they don't understand that the human body has 9 pints of blood, and that taking 5 pints of blood out of a human being in one day, yeah, that's going to cool a person's body off. And so in the thinking, it's adjusting the blood humoral back into balance, when in fact it killed poor George, right? His last line was, "I die hard," and he certainly did. It's estimated that he lost about 5 pints of blood in one day. So you can imagine with that type of therapeutic approach, and think about that. This is George Washington. He has the best physicians at his bedside, and he is being administered these heavy doses of calomel and having 5 pints of blood taken from his body. The public, the social, what we call the Bruno Latour introduces this idea of the actor network theory, where something that doesn't necessarily, when you're thinking about medicine and the practice of medicine and science of medicine, you don't necessarily think about the public's push to shift it. And in fact, that's what happens. All right. So the eclectic physicians grow out of this public desire and also a professional desire to create a more harmonious approach to medicine in treating the body. They are reacting to the tremendously violent interventions of heroic medicine that the allopaths are engaging with. By the time you get into, certainly by the turn of into the 1800s, bloodletting has gone by the wayside, not universally, but it's starting to lose favor, but calomel does not. Calomel sticks around to the point that in 1863, when Surgeon General William Hammond of the Union Army removes it from the medical supply wagons for the Union Army, he loses his job. He's fired. And this man was a fantastic Surgeon General and created an amazing system to help the Union Army. He loses his job for removing that. Now he gets reinstated and calomel comes back in. But the eclectics are growing out of this burgeoning field. All right, so what they want to do is they're also picking up on this French impulse of supporting the body through illness rather than the physician coming in and deeply intervening between the human body and the disease. All right, so that modern medical MDs are considered allopaths now. So what happens? Well, there is this fight for authority between the allopaths and the eclectics. In the 1800s, so by the time you get into the 1820s, this professionalization process is underway in the reforming of university systems. It's also this recognition that with the growing populace of the United States, that becoming a physician could be a good way for an individual who's in the working classes to take an apprenticeship and move up and go into the burgeoning middle class without having to go to university. And so there's this rise of professionalism is starting to happen. Now, there's a couple other things going on, but we're already down to half an hour, so I need to speed it up. So all of these things are going on. And the allopaths are starting to push against the eclectics. And they're pushing against the eclectics because the public is trusting the eclectics more. So if you go to your physician and that physician is an allopath and he wants to give you a Dr. Rush's Thunderbolt, versus you go to an eclectic physician who wants to give you a decoction of persimmon and black tea, brandy and sugar to fight your GI distress. Who do you think you're going to go to? Brandy, sugar, and persimmon, which is a fruit, versus a calomel tablet, right? You're going to go to this persimmon. You're going to go for this persimmon remedy because you're not going to be in bed or in the outhouse or whatever person's facility is at that time for 7 to 10 days waiting for this Dr. Rush's Thunderbolts to make its way out of you. The other idea that's going on too is you get sort of what I tell my students is you get this first sort of online medical education with Thomsonian medicine being created through catalogs. So obviously it's not online, but it's a catalog that people could order and then educate themselves in the Thomsonian approach. Now, the Thomsonian approach falls in line a lot with the allopaths, but he's using botanics rather than chemicals to eradicate illness. The eclectics arise in reaction to those intense interventions. And so they're advocating homeopathy, botanic remedies, electrotherapy, and hydrotherapy. Homeopathy restores the body to health through these minute doses of drugs. Samuel Hahnemann, so two Samuels, but Samuel Hahnemann is the one that introduces that idea of like cures like. Botanic doctors are using plants and other natural products, so you're going to have different resources. And even so, Francis Pierre Forchet was a big fan of monk's hood, which actually monk's hood is a type of fungal mushroom. It's very toxic. And he talks about how using it in these smaller doses for someone who is on the edge of death, how it's effective. So they're using these things in a more minute, safe way. Well, you can imagine that there's a push in this time period when you're thinking about the United States and the evolution of the Republican democracy that the United States is building during this Jacksonian period, and then into the antebellum period. There is, I want you to think about the 1840s in the way that we think about the 1960s. The 1840s were very much this social time to begin the social reform movement, social justice, right? So you have, and we're bringing this over from Great Britain, but these ideas of abolitionism and suffrage. And also, after the Civil War, we get the birth of animal rights, which is also connected to medicine and this resistance by the eclectics to resist against vivisection. And for those of you who don't know what that is, vivisection is live dissection. So the individual is alive, dogs were the number one subject. And the eclectics were very much against causing injury or causing harm, right? So if you look into the EMI and you go into their readings, into their writings, they are aware from as far back into 1854 with Dr. King, and also in 1865. And again, I mean, this goes throughout. John Uri Lloyd talks about this. I'm going to read you something from him later in 1917 about the allopath's intense pursuit to discredit eclectics' scientific approach to medicine. And by the time the American Civil War happens, neither the Union side or the Confederate side would allow eclectic physicians to practice as military physicians and surgeons. It was this approach to controlling the profession in that only those who were allowed to practice were Caucasian males from a Protestant middle class and upper echelon socioeconomic status. I was really interested in how this evolves and what's at stake. So you've got what you're looking at here is this idea of social structure and the outcome of historical processes. All right. So Paul Starr has a PhD in sociology, and he wrote this fantastic book about the growth of the American medical system in largely 19th century, and then he goes up to he just had a recent edition in 2016. So he comes up into modernity, but he argues that social structure is the outcome of historical processes. To understand a given structure arrangement, like professional sovereignty, one has to identify the ways in which people acted, pursuing their interests and ideals under definite conditions to bring that structure into existence. So what he's talking about there is these needs for education, the need for regulation, the need for licensure, and that's very much true. But unfortunately, what happens in this professionalism process is that the social constructs, the social norms of 19th century America, so the categories of race and gender and class, come into this process of professionalization, right? So when we're thinking about the origins of power of the medical profession, you absolutely have to stop and think about the political and economic forces that work in healthcare and continue to remain in healthcare. All right, so you're having this struggle, and in that process, then these implicit biases, and implicit biases are unconscious stereotypes, unconscious prejudice that we all have. Some of them are extremely harmful, and some not so much, and we don't even realize we have them. So my PhD is from Ohio State. I'm a professor at Ohio State. Ohio State saved my husband's life. I have serious Buckeye disease. All right, so I have serious Ohio State disease, and I was at down at Duke for a fellowship down there, and one of the professors leading this said, "Oh, you're the comp studies person from Michigan," and my body literally twitched and quivered, and the professor said to me, "Did you just twitch?" I said, "I think I did." So my implicit bias is that OSU is the best and that we can't mention the school up north. I had no idea that I held that deeply, to that my body would actually have a reaction to being accused of being from the school up north. And I'm rather fond of the school up north, actually. But anyway, but don't tell my Buckeyes that. So we have these implicit biases that we can't really access without introspection. Well, what's going on in the 19th century is people were not talking about being aware of implicit biases. People were not talking about recognizing that race, gender, and class are social constructs, that race is not a biological category, gender is not a biological category, class is not a biological category, that these are constructed. And they're very much believing in the science of those social constructs. And so built into this professionalization process is the assumption that people of color, women, and working class whites, and in that working class white perspective is the intersection of religion as well. That because they were more emotional in their cognitive abilities, that women, for example, because women have softer bodies, that meant that their minds were softer and they were more emotional, and therefore they could not deal with, engage with, be a part of the scientific medical perspectives of this burgeoning modern scientific field. And medicine is evolving in the 1800s, but that idea of how we understand scientific method now was not there until you get into the Koch Institute and you're getting into Pasteur. So you're talking about germ theory coming out in 1861. Joseph Lister introduces this idea of antisepsis in surgery in 1867. Pasteur continues to work and comes up with fermentation and pasteurization in 1868. And then, of course, Koch has his fantastic discovery in 1881, where he isolates a particular bacteria that causes a particular disorder, being tuberculosis. That scientific approach, where you're getting into Koch's postulates and this uniform set standard of how we do science, how we do experimentation, how we determine cause of illness, how we determine effective therapeutics. That happens at the end of the 1800s. This process of professionalism is beginning in the 1800s. It's beginning in the beginning of the 1800s, and is well on its way by the 1820s. Why? So when you stop and think about that, then these social constructs of race, gender, and class deeply informed the development of medicine from a therapeutic approach and from a professionalization approach. All right. In 1847, the American Medical Association was created. In 1852, the American Pharmacy Association was created. When you want to legitimate a field, you create a uniformed educational system, you create licensure, you create association. All right. So back to this point about kindly medicine. One of the ways that I believe the eclectic physicians were pushed out of being accepted as legitimate practitioners of science was because of their inclusion of people regardless of their social category, both as practitioners and in their treatment of their patients. So prior to germ theory being accepted, and I want you to take into consideration germ theory, not everybody accepts it, in 1861, it's floating around, there's evolution of it, that it continues to progress. But certainly by Koch's determination, germ theory had been well accepted. The United States and again, this isn't uniform, but the belief that something, that this little microorganism could cause a disease was not accepted. Germ theory was not accepted universally until President Garfield, died not from his bullet wound, which he was shot in July 1881, and dies in September. He dies not from the bullet wound, he dies from the infection, because his physicians were constantly probing him without clean hands. They weren't washing the wound. It wakes practitioners up to the recognition that germ theory is fact and not this theory, that it's not something that's being put forth by eclectics, who the allopaths deemed as not being men of science because they allowed women, people of color, and people of differing religions to practice, to come to their medical schools and to practice. And then also, far before germ theory was accepted in the allopathic realm, the eclectics, that now they didn't talk about germ theory in the way that we understand it now, but what they talked about was this, that cleanliness seems to have an effect on positive outcome. And one of those positive outcomes was in the reduction of anxiety in their patient. So one of the lectures that Dr. Scudder gives to his students, so Dr. Scudder was another eclectic physician and professor at the Eclectic Medical Institute in Cincinnati. One of the arguments that Dr. Scudder gives to his students is that if they have an office and a waiting room, they need to keep it clean. It needs to be brightly lit. It needs to be welcoming when their patients come in. As the physician needs to wash their hands. If their apron or their clothing has gotten dirty in treating the previous patient, they need to change their apron, change their clothes. That the sight of blood is unnerving to the patients, and that out of compassion and dignity for the patient, the mental well-being of the patient, the physician needs to change clothes and approach the patient from a mind-body perspective rather than just going at the body, that it was connected. And by the time we get into this period in the 1820s, this mechanization of nature and the human body was deeply ingrained in medicine, meaning that what we in modern medicine are largely accustomed to, which is sectioning off parts of body as, okay, you have a headache. Well, you must have some sort of neurological disorder or something. Well, maybe you just have way too much stress for some reason, or you've eaten something bad and you're having allergic reaction, or whatever. There's all kinds of different causes for a headache. And so what the eclectics were talking about was having a narrative background, having a conversation with their patients rather than just going at the symptom and just treating the symptom. Is the person getting good sleep? Do they have ventilation? Do they have good nutrition? Do they feel supported at home? Are they under threat at work? Whatever the issue is. And so they're treating them as a whole person. The allopaths argued that there was no science behind this, and that by engaging in this emotional aspect of medicine, rather than staying in the hard sciences of medicine. And I want you to think about how hard that science was when we have these social constructs that are arguing about people's intellect based on their race, gender, and class. The allopaths were arguing that because of this approach, this emotional approach, this acknowledgement of the human experience of disease as being traumatic, that they had effeminate minds. And that an effeminate mind was not capable of logic and rationale. And if the effeminate mind was not capable of logic and rationale, then the practitioner could not practice sound scientific medicine. And so by default of treating patients with equality and acknowledging people, regardless of race, gender, class, religion, into their medical schools and then as licensed practitioners, their medicine by default was effeminate and couldn't be trusted. That the standard of logical, rational approach to medicine could not be applied, was not embraced by eclectics. And the eclectics pushed back. They pushed back. So this is the preface of this quote that's on your slide here. This is the preface of John King's The American Eclectic Dispensatory. So as early back as in 1854. Now it's very contentious in the 40s and 50s between the Allopaths and the sectarians, but the Allopaths are holding on. And he is pushing back and he's angry about these implications that eclecticism was something less than, that eclecticism was giving into popular medicine, giving into these populist ideas of how to approach disease. And what he's arguing is that the eclectic physician is very much a part of this engagement with comprehensive science that's going on in the 19th century when we talk about medicine, right? He's also pushing back on the fact that allopathic physicians didn't start changing their approach until we get into this time period where the populace is saying, you know what, I think I'm just going to stay away from your Dr. Rush's Thunderbolts. And I think I'm going to avoid your Lancet. And, maybe I'll just see if I can treat myself. Maybe I'll go see if I can find an Amish physician or, talk to the widow herbalist in town that everybody knows about. This pushback is going on. There's a newly educated Thomsonian physician. Maybe I'll go talk to him. And so they're pushing, the Allopaths are shifting their approach, not totally. You're getting this shift in the Paris clinic with the idea of supporting the body. But in the United States, and many physicians, so in the United States, in the medical education system until after the American Civil War, dissection was illegal. So people who could afford it, so Oliver Wendell Holmes, Francis Pierre Porcher, they went to the Paris clinic after they graduated from medical school in the United States to participate in the Paris clinic to learn about dissection, where they could see surgeries, they could see dissections, they could participate and learn the art of surgery, which doesn't really come into prominence in the United States until the American Civil War. Now, King, in this quote here, this assumption of infallibility in the existing and prevalent systems of the therapeutics, or rather the right to enforce its acceptance by dishonoring all who dissent from its doctrines, is too exaggerant to bear the test of serious examination. Why is he saying that? He's saying that because, as I said earlier, this idea of humoral theory is put forth by Hippocrates in 400 BCE, and it doesn't get challenged until we get into the Paris Clinic from 1790 to 1850, right? So what's going on there? Medicine is slow to change. Medicine is slow to challenge these doctrines. What King is talking about here is how can the Allopaths rationally and reasonably argue that the Eclectics are doing something negative when for centuries this notion that the body had these humors that would get out of balance and the physician had to go in and intercede was what was embraced as truth. What he's arguing there is that the allopaths are as much a part of infallibility, of wrong knowledge in the medical sciences. And he goes on to actually say, if not more than the eclectics. All right. So the last thing I want to read to you is, sorry, I rushed through that a little bit, is something that John Uri Lloyd talks about. So he writes this article called The Odium of Eclecticism in 1917. And he is angry. By the time you get into the progressive period and the Flexner report, eclectics are being pushed out very forcefully, very forcefully. And John Uri Lloyd is upset. I would go so far as to say, given the language that he uses, I'd say he's quite angry. But one of the things he's talking about in this odium of eclecticism, that somehow that word odium is this insult, right? That he is talking about this idea of this slavery to authority. So go back to King's point of the humorals and Hippocrates and Galen. So those ideas that those are holding on. So, quote, slavery to authority. This term surely cannot be as directly applied to the early eclectics as to their regular antagonists. So he means the Allopaths. Eclecticism was born as a protest against authority that came from Europe. And in the opinion of the early eclectics, this misguided authority bound the minds of the regular professions to many undesirable methods of medication that could not be displaced except for by breaking away from the subjection to that authority. It is unnecessary for me to go into details concerning these once conspicuous differences. They are in the hand of history. If the word odium be attached to persons who in those early days opposed the subjects of misguided authority, we must bear the blame that rests upon us, but we certainly have not shared the sins of the men who most directly inherited the term. I see no cause why the term odium should rest on any helpless man who mistakes by reason of the fact that he is the blind subject to authority. So he goes on in that article to continue to contest this idea, and that this fight that the Allopaths have waged with the eclectics is actually about, and to use his word, rivalry. Among my business rivals, among them some of my dearest friends, the time has long since passed when any touch of personal unfriendliness came to me in these connections with the term rival. But personal animosity towards rival physicians is prevalent. What he's talking about there, and the EMI graduates its last class in the, I believe it's 1942, the early first couple of years of 1940. And the EMI is the last eclectic medical university to graduate a body of physicians. What King's talking about, what Scudder's talking about, what Lloyd is talking about, is that the attacks on eclectic practitioners is no more valid than this idea of humoral theory and the Allopaths' denial of their continuing those erroneous ideas as if they always had the perfect understanding of medicine as a scientific practice. So I could talk for 5 more hours, but it's 8 o'clock, so I will stop there. Thank you.
Thank you, Amy. That was really fascinating and took us much deeper than many of us probably knew about the eclectics. Couple of things that you said that really stuck out to me is one, you were talking about the emphasis on sanitation and of course, or cleanliness. So we all can understand how that is valuable to be in a sanitary environment. But the whole idea that that also contributed to the reduction of anxiety was a new one to me. I also was fascinated about, I think those of us that have a little bit of a background on the eclectics know that they were about treating the whole body and not just the symptoms. But the emphasis that you talked about tonight on the emotional aspects of health and the way the practitioners did a narrative background, tried to find out more of what was going on. You gave the example of having a headache, that could be any number of things. And that part of that interview process, if you will, helps the health practitioner or the doctor to better understand that. And these are things that I see starting to come into what you would refer to as allopathic, or I would call perhaps conventional medicine. And I wonder if you have ideas or opinions of why we see some of these practices from the eclectics starting to work their way into our experience that we might have with our regular primary care doctor.
Thank you, Patricia. That is a great conversation, and it's one of the things that I'm looking forward to in my transition to the College of Pharmacy. So, for those of you who've heard of the idea of medical humanities, it comes out of what Oliver Sacks puts forward with this idea of reintroducing the idea of case studies. All right. So for any of you who know the film, The Awakenings with Robert De Niro and Rob Williams. Okay. So Sacks actually publishes his book in 1977, but it doesn't really take hold until this film talks to the power of Hollywood. And this idea, particularly with neurology, because symptoms show up in different ways. You have to individuate the medicine to treat the disease, to treat the disorder. How do you individuate the medicine if you don't have a conversation, if you don't have a narrative with the patient? And so one of the things that what we're learning is that if students have a background in medical humanities, if we can catch them in their undergraduate studies with the aspect of the human experience of medicine, which is isolation, which is trauma, which is economic devastation, all of these ideas, is that when they get into their professional school, whether they want to be physicians, nurse practitioners, pharmacists, veterinarians. I love my history and medicine class because there's 40 students in there and almost all of them are pre-healthcare people. And so I have this vast approach to the class to try and appeal to them. And it's just an interesting class. And they're fascinated on this conversation of ethics, because what we have to do is catch them in the undergraduate. So when they're practitioners, they maintain and hold on to the human aspect that is disease. Because at the end of the day, a virus is a virus. Why do we care? What did it do to the person it affected? Or what did it do to the person that you loved? How does it interact with an individual's experience? And that gets lost in this mechanization process in the 1800s, but the eclectics never lose it. And I just have so much respect for them. I just think they're fascinating.
Well, Amy, we have a question from Susan, touching on a number of things, especially not far from our area historically, and that is, what was the relationship between the Worthington Medical Institution, Transylvania University, Daniel Drake, and the Medical College of Ohio in what was viewed as the medical sharing of knowledge, medicine, and advancements in that time frame?
Well, that's a little outside of my expertise on in-depth level, but the Worthington Institute actually moves and becomes the Cincinnati Medical Institute. So the EMI comes from Worthington. Worthington gets pushed out because of medical school in Columbus. So, as far as I'm aware, it was pretty contentious, but Patricia, you may know more and be able to speak to that more than I can.
I know that here in Cincinnati, of course, a lot is known about Daniel Drake, and Transylvania University was one of the earlier medical schools too in this region. I don't have any information on right at hand on the extent to which they shared and not, but one of the things that we can do is we can check and see if we can locate anything, and certainly get back to folks with an answer on that if we have it. And again, this is a really early time frame, 1815 to 1840. So this sort of predates the Eclectics. We also have just a thank you from another viewer. Thank you for a great webinar, and that it was fascinating to learn about the EMI concepts in a historical and scientific setting. So thank you very much, Amy. So again, I would like to thank you for joining us this evening, both Dr. Greg and our audience. And watch for this program to appear on our YouTube channel. I hope also that you can join us later this month for bird monitoring technology for migrant bird conservation with Dr. David Russell. You can find information to register on our website and also through our social media. And finally, I'd like to remind you that programs like these are made possible in part through membership at the Lloyd. If you're not already a member, I hope you consider joining the Lloyd. You can find information about that at our website, which is lloydlibrary.org. And thank you again, and have a wonderful evening.
Thank you.